My name is Dr. Robbie Harriford. I'm the Chief Medical Officer and one of the women's health providers at Samuel U. Rogers Health Center, which is in Kansas City, Missouri. We are a federally qualified health center. The majority of our patients are refugees and immigrants. About 60% of our patients are best served in a language other than English. We decided to prioritize working with Upstream because honestly, it came straight from our patients. We've always provided contraception, but the process itself wasn't streamlined. So for instance, there were some cases where patients were having to wait over a month to get an IUD. You hear that over and over. You start to think, like, what can we do differently? The challenges within our health center were, the biggest one was our billing. We were billing, we just weren't capturing everything that we needed. And so that was one of the biggest things that I wanted to work on with Upstream. And I think also just knowing that our patients weren't feeling as satisfied with the care because they were having to wait so long, I wanted to be able to come up with a way that we could provide same-day access. Working with Upstream has literally been a dream. It's been incredible. They initially, with our first team, sat down with us to walk through what it is that we were wanting, what it is that we were missing, what it is that we're actually doing great, because they wanted to be able to kind of tailor what we're doing to include some of the good things that we're doing, but also if we needed to tweak things. They sat down in each department. So it wasn't just with us as providers, it was with our staff that's doing the rooming. It was with our billing department. It was with our director of clinical operations. And then we collectively came up with a plan to move forward with what we prioritize. I am most proud of probably two things. One, same day access for our patients, because our patient population oftentimes is kind of forgotten about, or they don't have that same options or the same time frame. So for us to be able to give this to them in, previously from a month now to the same day, that's huge. But I honestly think that the biggest thing for me is the effect that it's had on our staff, our MAs and our LPNs, that room that kind of helps start the conversation. They are feeling so much more empowered because they are active participants in the visit. They're not just taking blood pressure anymore. They are starting that conversation and they've had that training to feel confident. And you can just see it in their face. Like, they love being a part of it, and they're actually working at the highest level of their licensure. There has been an impact for our bottom line. Now we are actually getting all the money that we're supposed to, and we were able to recover a little bit of what was lost from the past. So it's been a great experience. You should work with Upstream because they are phenomenal. They work with you. They aren't trying to tell you what to do. They really look at your health center or your hospital or whatever program you have, and they want to make it work for you guys. So I say, run, don't walk. Please work with Upstream.